Hi, my name is Pamela Rist. I'm an associate epidemiologist at Brigham and Women's Hospital and also at Harvard Medical School. My abstract was on migraine and the risk of incident hypertension among women. So we've known for a few years that migraine seems to be associated with an increased risk of vascular disorders, particularly stroke and even myocardial infarction. The question was, is it associated with a disorder like hypertension as well? And the evidence on this is actually pretty mixed, and most studies were not able to tease out sort of what happened first. Did migraine precede the hypertension, or did hypertension precede the migraine? So using a prospective longitudinal design, we are actually able to look at, do migraineurs have an increased risk of hypertension, developing it in the future, compared to people who do not have migraine? So to do this, our study was called the Women's Health Study. So it's a cohort study of female health professionals aged 45 or older at baseline. And now we have an average of 12 years of follow-up for our hypertension outcome. And what we found, looking in this study, was that women who experience migraine do appear to be at an increased risk of hypertension, anywhere from a 10 to 20% risk, depending upon their specific migraine subtype, compared to women who don't have any history of migraine. So most of the prior research on migraine and the risk of stroke has controlled for variables like hypertension. So they're looking, even if you don't have hypertension, does migraine increase your risk of stroke? And those studies have shown that yes, it does seem to increase your risk of stroke, or it's a risk marker at least. So for our study, I think the message is more for primary care physicians potentially, that migraineurs, regardless of whether they experience aura or not, do seem to be at an increased risk of hypertension. So it's something to look for in your patients and screen them for it. And there's a variety of treatments too that could be used, and that's sort of the next area. What treatment should we be using for migraineurs?